morning, Paul. How are you doing? Good. Can I have you tell me your name and date of birth? Paul Brown, May 4th, 19XX. And I see you have an allergy to penicillin. Is that correct? Yes? Okay. I'm going to go ahead and do a quick head to toe assessment of you, and then I'm going to get your vitals. Okay, so I got those. They look good. We noticed that like your blood sugars are a little high, so we're going to go ahead and give you some insulin. And I know that you've had it before. Where do you normally give it to yourself at when you're at home? In the stomach? Okay. Well, I'm going to go ahead and give it to you up here in your deltoid area, if that's all right with you. I'm going to go and get that drawn up, and then if you have any more questions, I'll answer them. Do you have any before I go? No? Okay, so so this is my NPH, and I'm just going to make sure that I have NPH. And then it's 100 units per milliliter, which is correct. And I'm also going to double check that to my MAR that I need 100 units per milliliter NPH, which is also correct. And that's my first and my second check. And then I'm going to also go back into the Pyxis and get the regular, which is an F1. So I'm going to go ahead and just do my first check, double check that to the MAR, the 100 units per milliliter. And then, or to the Pyxis, and then I'm going to double check it to the MAR also again, which is the 100 units per milliliter. So I know that I'm going to need a syringe. I prefer to use the 50 milliliter because I can see the numbers better, if that's an option. And then I'm going to need alcohol swabs. And then I know that I'm going to end up needing 32 units total when I'm done, which is just a side note for myself. If this was an actual thing, I would be having another nurse second check because I'm mixing the insulins with the cloudy and the clear. So I'm going to scrub each hub for 10 seconds. Okay, and then I'm going to go ahead and take my insulin. And I know that I need to inject air in first, but you start with the cloudy. And so I need 18 units of cloudy. So I'm going to do 18 units of cloudy and put the air in there. And then I'm just going to leave it. And then I need 14 units of regular. So I'm going to drop 14 units of regular, and I'm going to put that in my regular, and I'm going to draw back the 14 units. Okay, and then I'm going to draw back to 32, which would be my 18 units of the NPH insulin. So I have 32 units total of insulin. Again, I would have this double checked by a nurse who would also verify that that is correct. So then I'm going to make a label since I'm not making this up in the patient's room. And on my label, I'm going to put that it's 18 units of NPH and 14 units of regular, and that it's for Paul Brown. And also make sure that they know that it's insulin. And then I'm going to go ahead and go back to Paul's room. little. Hi Paul, how are you? I'm back. Still feeling alright? Okay. I just need you to go ahead and tell me your name and date of birth again. Paul Brown, 5'4", 19XX, and you have an allergy to penicillin. Alright. Thank you. So I came back and I have your insulin. I have 18 units of NPH and 14 units of regular insulin. Does that sound about right? Okay, are you okay with this? Alright. So I'm going to come up here to his arm and I'm going to put 3 fingers. And then I'm just going to inspect for bruising and anything abnormal, which there's not. It looks good. And then I'm going to take my alcohol swab and start in the center and work my way outward in circular motion for 10 seconds. Okay. And then I want to make sure I put gloves on. And then I'm going to go ahead and uncap my needle, and I'm going to go in. I can either go in at a 45-degree angle or a 90-degree angle, but for him, he doesn't have a lot of sub-Q fat, so I'm going to go in at a 45. I'm going to pinch the skin, go in at a 45, and then I'm going to slowly inject it. And then I'm going to put my safety on and put it in the sharps container. And then I'm going to, he has a knowledge deficit, so I'm going to give him some teaching, and that is to lower his blood sugar, and that it could make him dizzy if it makes him drop fast, or change the way that he feels, and that he could use his call light to notify me if it does, and to be cautious when getting up. And then I'm also going to use the nursing diagnosis of risk for fall, because with it, like if it makes him dizzy or anything like that, when he gets up, he could fall down. And then I would document that I gave it to him and the subcutaneous tissue of his right lateral arm. And then I would also document that the time that I gave it to him and how much I gave to him of each type of insulin, and I would sign it and date it. And that's it.